When asked if one should go for testosterone injections as an adult, many individuals and doctors have advocated testosterone replacement therapy, TRT, on the grounds of that. Typically, testosterone levels in males peak during late adolescence and early adulthood, around the ages of 18 to 25. After reaching this peak, testosterone levels generally start to decline slowly, at a rate of about 1 to 2% per year after the age of 30. In females, testosterone levels tend to peak slightly earlier, generally between the ages of 18 to 20. Similar to males, women's testosterone levels decline with age, especially after menopause, when there is a more pronounced drop in testosterone production. So why is testosterone so important? Testosterone is a crucial hormone in both men and women, though it plays different roles and is present in different amounts. Here are its functions in both genders. Functions of testosterone in men. 1. Development of male reproductive tissues. Testosterone is essential for the development of male reproductive organs, including the testes and prostate. 2. Spermatogenesis. It plays a key role in the production of sperm. 3. Secondary sexual characteristics. Responsible for characteristics such as increased muscle mass, body hair, including facial hair, deepening of the voice, and enlargement of the Adam's apple. 4. Muscle and bone mass. Promotes muscle growth and increases bone density, playing a role in overall strength and endurance. 5. Sex drive. Libido influences sexual desire and libido. 6. Mood and behavior. Impacts mood, energy levels, and mental health. Low testosterone levels can lead to mood swings, depression, and irritability. 7. Fat distribution. Affects fat distribution in the body, often leading to a reduction in body fat. 8. Red blood cell production. Helps stimulate the production of red blood cells in the bone marrow. Functions of testosterone in women. 1. Sex drive. Libido similar to men. Testosterone is important for sexual desire and libido in women. 2. Bone strength. Contributes to maintaining bone density and strength, which is particularly important for preventing osteoporosis. 3. Muscle mass and strength. Helps maintain muscle mass and strength, especially after menopause. 4. Mood and energy levels. Plays a role in mood regulation, energy levels, and overall sense of well-being. 5. Reproductive tissue health. Supports the health of ovarian function and contributes to the regulation of the menstrual cycle. 6. Fat distribution. Affects fat distribution and muscle tone in the body. While testosterone is often associated with men, it is vital for women as well, particularly in maintaining muscle and bone strength, overall energy, and sexual health. Both too low and too high levels of testosterone can lead to health issues in both genders. Several hormones and factors can contribute to lowering testosterone levels in the body. Here are some key ones. A. Cortisol. Often referred to as the stress hormone, cortisol is released in response to stress and can inhibit testosterone production. Cortisol is produced by the adrenal glands and plays a key role in regulating metabolism, immune response, blood sugar levels, blood pressure levels, and the body's stress response. Chronic stress leading to prolonged cortisol elevation can significantly suppress testosterone levels. Therefore, put some content into context with regards to male adolescents' testosterone peaking between 18 and 25, or that of a female peak between 18 and 20 years of age. We have to consider comparing the stress of an 18-year-old to 25-year-old living at home with a roof over their head, free food, and maybe their only concern is passing matric or a pimple right in the middle of their forehead, compared to that of a male or female who has to make sure they work hard enough to earn enough to feed children, living in a house of chaotic children, working a job they may not like or they do like, yet very demanding, concerned 24/7 about their children there. Spouses, if they will have enough money to retire, or concerned that with the political landscape as it is currently in its form, let alone the world, the way the politicians are slowly killing off the country, would they or their family still have a future, and many other concerns piled onto their plate. And the list goes on. But did anybody ask or address the suppression of testosterone production from raised cortisol levels due to the following cortisol stimulating factors? A. Chronic psychological stress. Psychological stress from work, personal relationships, financial difficulties, or emotional trauma can trigger the body's fight or flight response, leading to prolonged cortisol release. Over time, chronic stress can lead to persistently high cortisol levels, which may contribute to anxiety, depression, and other health issues. B. Poor sleep quality and sleep deprivation. Inadequate sleep, insomnia, or irregular sleep patterns can cause cortisol levels to remain elevated. Cortisol normally decreases during sleep, but if sleep is disrupted, the body perceives it as a stressor. Elevated cortisol due to poor sleep can lead to fatigue, impaired cognitive function, and metabolic disturbances. The converse is also true. Elevated cortisol levels makes one wake up when asleep or battle to fall asleep when elevated. Cortisol is called the waking up hormone. When at a certain concentration in the blood, we become more conscious and awake. Elevated cortisol can be due to stress-related or plainly the mind never stops yakking. The mind is constantly busy. C. Unhealthy diet and eating patterns. Diets high in refined sugars, processed foods, and simple carbohydrates can cause blood sugar spikes and crashes, triggering cortisol release to stabilize blood sugar levels. A frequent consumption of caffeine and alcohol can also elevate cortisol levels, particularly when consumed in large amounts or close to bedtime. D. Overexercising or lack of exercise. While moderate exercise can help lower cortisol, excessive or intense exercise without adequate recovery can raise cortisol levels due to physical stress on the body. On the other hand, a sedentary lifestyle with little or no physical activity can lead to poor stress management and higher cortisol levels. E. Social isolation and lack of social support. Humans are social creatures, and a lack of social support or feeling isolated can increase perceived stress and elevate cortisol levels. Strong social connections and support networks are associated with lower cortisol levels and better stress management. F. Prolonged screen time and digital overload. Excessive use of electronic devices, especially before bedtime, can disrupt circadian rhythms and sleep patterns, leading to higher cortisol levels. A digital overload can contribute to mental fatigue, stress, and increased cortisol production. G. Dehydration. Inadequate hydration can stress the body, leading to increased cortisol production as the body tries to maintain homeostasis. Even mild dehydration can affect cognitive performance, mood, and stress levels. H. Chronic pain or physical stress. Persistent physical pain or discomfort from conditions like arthritis, migraines, or injuries can continuously signal the body to release cortisol. Chronic pain management is crucial to prevent the negative effects of long-term elevated cortisol. I. Negative thought patterns and anxiety. Constant negative thinking, rumination, and anxiety can trigger the body's stress response and increase cortisol production. Mindfulness practices, cognitive behavioral therapy, and relaxation techniques can help reduce cortisol levels by altering thought patterns. J. Intermittent fasting or extreme dieting. While controlled intermittent fasting can have health benefits, extreme calorie restriction or long periods without food can elevate cortisol levels as the body perceives a state of starvation stress. This can lead to muscle breakdown, slower metabolism, and increased fat storage. K. Exposure to environmental stressors. Exposure to noise pollution, air pollution, or extreme temperatures can act as chronic stressors, leading to elevated cortisol levels. Creating a calm, clean, and safe environment can help mitigate these effects. 2. Estrogen. Higher levels of estrogen, particularly estradiol, can negatively impact testosterone production. This is especially relevant in cases where there is an imbalance between testosterone and estrogen. I- When the body is under stress, it may divert resources like pregnenolone to produce more cortisol, the stress hormone. This is sometimes referred to as the pregnenolone steal, where the production of progesterone decreases in favor of cortisol, potentially leading to elevated estrogen levels due to the relative drop in progesterone. B. Body fat. Higher levels of body fat, especially visceral fat, can lead to increased aromatase activity, such as in men with higher body fat percentages. Aromatase is an enzyme that converts testosterone to estrogen. This process can increase estrogen levels, particularly in men. Insulin resistance. Insulin resistance can increase aromatase activity and therefore estrogen production, contributing to elevated levels. C. Liver function. Impaired liver detoxification. The liver is responsible for metabolizing and clearing excess estrogen from the body. If liver function is impaired, or there the amount of estrogen far exceeds what the liver can cope with, estrogen can accumulate. Factors such as alcohol consumption, poor diet, and certain medications can affect liver detoxification pathways as well. The idea that liver issues are connected to unresolved anger or emotional stress comes from holistic and traditional medicine perspectives, particularly traditional Chinese medicine, TCM, and certain holistic or alternative health practices. These approaches suggest that emotional states can affect physical health, and that specific emotions may be linked to the health of certain organs. 1. Psychoneuroimmunology. 1. Modern scientific research in psychoneuroimmunology studies how psychological factors, like chronic stress or negative emotions, affect the immune system and bodily functions. Chronic anger and stress can lead to elevated cortisol levels, increased inflammation, and potentially impact liver function. 2. Inflammatory response. Prolonged emotional stress is associated with inflammation, which can affect liver health. Chronic inflammation may lead to or exacerbate conditions like non-alcoholic fatty liver disease, NEFLD. 2. Coping mechanisms and liver health. 1. Substance abuse. People who struggle to cope with emotions such as anger or stress may turn to alcohol or drugs, which can severely impact liver health. Alcohol, in particular, is directly toxic to liver cells and can lead to conditions like alcoholic liver disease, cirrhosis, or liver cancer. 2. Unhealthy lifestyle choices. Chronic anger and stress can also lead to unhealthy lifestyle choices, such as poor diet, lack of exercise, and insufficient sleep, all of which can affect liver health. There's a saying that if you're a hammer, everything in life looks like a nail. Similarly, if someone is an angry person, they will see the world through the lens of anger. When in a state of anger, the body triggers a fight or flight response, leading to the release of cortisol. High cortisol levels increase pregnenolone production, which would normally be converted into progesterone. Elevated progesterone can suppress estrogen because both hormones compete for the same receptor sites, but progesterone always takes precedence. D. Environmental estrogens, xenoestrogens. Exposure to endocrine disruptors. Xenoestrogens are synthetic compounds found in plastics, pesticides, cosmetics, and other industrial products that can mimic estrogen in the body. Chronic exposure to these substances can contribute to elevated estrogen levels. E. Dietary factors. High intake of phytoestrogens. Foods that contain plant-based estrogens, such as soy products, can contribute to increased estrogen activity in the body. Though phytoestrogens are weaker than endogenous estrogens, they can still impact overall estrogen levels. Alcohol consumption. Alcohol can increase estrogen levels by affecting liver function and aromatase activity. F. Medications. Hormone replacement therapy. HRT estrogen-based hormone therapies can lead to elevated estrogen levels. Certain birth control pills. Some oral contraceptives contain synthetic estrogens, which can contribute to higher estrogen levels in the body. G. Thyroid dysfunction. Hypothyroidism. Low thyroid function can slow down metabolism and impact hormone balance, often leading to higher estrogen levels due to decreased clearance by the liver. Or is it the emotional stress that increases the cortisol levels, which increases the estrogen levels? When cortisol goes up, as a protective mechanism, the thyroid must. H. Age and menopause. Perimenopause. During perimenopause, progesterone levels often decline faster than estrogen, leading to a relative estrogen dominance. Postmenopause. After menopause, while estrogen levels drop, the imbalance between estrogen and progesterone can still result in symptoms of estrogen dominance. 3. Prolactin. Elevated levels of prolactin, a hormone produced by the pituitary gland, can lower testosterone levels. High prolactin levels can inhibit the secretion of gonadotropin-releasing hormone, GnRH, which in turn reduces the production of luteinizing hormone, LH, and subsequently testosterone. 4. Sex hormone binding globulin. SHBG. Sex hormone binding globulin, SHBG, is a glycoprotein produced mainly by the liver that plays a crucial role in regulating the bioavailability of sex hormones in the bloodstream. SHBG binds to sex hormones, particularly testosterone and estrogen, and controls the amount of these hormones that are available for the body to use. SHBG binds to sex hormones like testosterone, dihydrotestosterone, DHT, and estradiol, making them biologically inactive while they are bound, thereby ensuring that hormone-sensitive tissues do not become overwhelmed by excessive hormone levels, which could cause various health issues. SHBG is a protein that binds to testosterone in the bloodstream, reducing the amount of free testosterone available for the body to use. High levels of SHBG can thus lower the levels of bioavailable testosterone. Other factors that increase SHBG are I. High estrogen levels. 2. Hyperthyroidism. 3. Liver disease. Here is where our anger issues can arise again. Cirrhosis. 4. Medication. Hormone replacement therapy, HRT, and anti-seizure medications. V. Systemic inflammation. Conditions characterized by systemic inflammation, like rheumatoid arthritis or lupus, can cause fluctuations in SHBG levels, though they are more commonly associated with lower levels. 5. Insulin. Insulin resistance, often seen in individuals with obesity or type 2 diabetes, can contribute to lower testosterone levels. Insulin resistance is associated with increased levels of SHBG and decreased testosterone production. 6. Leptin. Leptin is a hormone produced by fat cells that regulate energy balance. High levels of leptin, which are common in obesity, can impair the hypothalamic pituitary gonadal (HPG) axis, leading to reduced testosterone production. Understanding these hormones and their interactions is crucial, especially when addressing testosterone-related issues through lifestyle, diet, or medical interventions. Some of your friends, or even your doctor, will encourage one over the following benefits regarding testosterone therapy. 1. Improved muscle mass and strength. Testosterone is essential for muscle protein synthesis, and TRT can help improve muscle mass and strength in older adults. An increased muscle mass can enhance overall physical function, reduce frailty, and improve quality of life. 2. Increased bone density. Testosterone plays a crucial role in bone health. TRT has been shown to increase bone mineral density, particularly in the spine and hips. This can help reduce the risk of osteoporosis and fractures, which are common concerns in older adults. 3. Enhanced mood and mental health. Low testosterone levels are associated with mood disorders such as depression, irritability, and anxiety. TRT may help improve mood, reduce symptoms of depression, and enhance overall emotional well-being. Better mental health can contribute to a more active and engaged lifestyle. 4. Improve libido and sexual function. Testosterone is crucial for sexual desire and performance in both men and women. TRT can help restore libido and improve erectile function in men experiencing age-related declines. Improved sexual health can lead to better overall quality of life and relationship satisfaction. 5. Increased energy levels and reduced fatigue. A low testosterone can cause fatigue and decreased energy. TRT can help increase energy levels and reduce the feeling of tiredness. More energy can support better participation in daily activities, exercise, and overall vitality. 6. Improved cognitive function. Some studies suggest that testosterone may have a positive effect on cognitive function, including memory, attention, and spatial abilities. This can be particularly important in older adults to maintain independence and quality of life. 7. Better metabolic health. Testosterone injections may help improve insulin sensitivity, reduce visceral fat, and support better lipid profiles. This could potentially lower the risk of developing metabolic syndrome, type 2 diabetes, and cardiovascular diseases. Considerations and risks. While there are potential benefits, testosterone replacement therapy comes with risks that need to be weighed carefully, especially in older adults. Cardiovascular risks. TRT may increase the risk of heart attack, stroke, and other cardiovascular events in some individuals. Prostate health. In men, TRT can potentially increase the risk of prostate enlargement or exacerbate pre-existing prostate cancer. Sleep apnea. TRT may worsen obstructive sleep apnea in some individuals. Polycythemia. Increased red blood cell count, which can lead to blood clots. Hormonal imbalances. Potential impacts on other hormone levels, including estrogen, leading to side effects like gynecomastia, breast enlargement in men. When considering testosterone replacement therapy, TRT, injections, it's important to think about how much of the injected testosterone might be affected by factors like elevated cortisol and estrogen levels, liver function issues, or even emotional states such as anger. Elevated cortisol, for example, can interfere with hormone balance, and increased estrogen can lead to unwanted effects like gynecomastia, enlarged breast tissue, and mood swings. Additionally, some of the injected testosterone may convert to estradiol, further influencing these outcomes. Think of it like tuning a guitar string. If it's too tight or too loose, the note is spoiled. Similarly, if a hormone level in the blood is too high or too low, it can lead to imbalance and disease. The dosage of testosterone given in TRT is usually a standardized recommendation from pharmaceutical companies. For one person, this dose may be just right, while for another, it could be too much, leading the body to spend extra energy breaking down the excess testosterone. This excess can then cause side effects, ranging from mood changes and fluid retention to more serious issues like cardiovascular problems. It's essential to ask yourself, do the potential long-term side effects outweigh the benefits? This isn't just about a short-term boost. TRT is often a lifelong commitment. If you stop the therapy, you may return to the baseline condition, or even worse off, given that other aspects of lifestyle and health may not have been addressed. Making significant lifestyle changes can often feel more challenging than managing the side effects of testosterone therapy. So, we must ask ourselves, when is enough truly enough? When do we have enough money, enough success, enough validation from others? When do we stop seeking more and start focusing on balance and well-being? These are questions that go beyond hormones. They speak to our entire approach to life and health. If you don't stop drinking that 6 cups of coffee a day or the 2 liters of Coke a day, then your testosterone therapy is similar to pouring a cup of water on a forest fire. Now, on the other hand, if you change your lifestyle, guess what? There are no risks. It's essential for individuals considering testosterone therapy to consult with a healthcare provider to evaluate their specific health status, benefits, risks, and whether TRT is appropriate for them. Would you like more detailed information on the potential risks or how to manage them?